Congratulations on your newborn! This is truly a momentous point in your life, and we at the American Sickle Cell Anemia Association cannot be more happy for you and your family. However, this joyous occasion often comes with some level of uncertainty. Many new parents, perhaps including yourself, are often concerned about the variety of newborn screens and tests required for your child. Well, if you have any concerns, you've come to the right place. My name is Jessica Frank, and I am a newborn screening coordinator at the American Sickle Cell Anemia Association. And today, I'm going to be running through some tests that your newborn may likely undergo while highlighting the specific tests that ASCAA are focused on. Firstly, why is newborn screening important? Well, in order to guarantee a child's healthy development, it is necessary to test for medical conditions that may adversely affect their health and well-being. In many cases, harmful diseases and conditions may not always be obvious or present themselves at birth. In these instances, newborn screenings and tests are vital for early diagnosis and treatment. Identifying and treating potential issues serve to keep your child healthy and safe. Well then, what tests may be conducted? It is important to understand that each state and territory have different mandates for newborn screening. However, all 50 states do have some level of required testing. Here are a few of the potential tests that your child may likely undergo. A hearing screening is one such test. It consists of two simple, non-invasive tests generally conducted in the nursery in no more than 15 minutes and can be completed prior to leaving the hospital. Another test that may be conducted is pulse oximetry screening, which identifies multiple congenital heart diseases. It is conducted with a machine called a pulse oximeter that places sensors against your baby's skin, measuring the amount of oxygen in their blood. The test is quick, painless, and usually conducted within 24 hours after your baby is born. A third potential test is blood spot screening, which involves a few drops of blood collected usually from a small heel prick. The samples are then tested for a variety of conditions and diseases, including sickle cell. This test is usually conducted a day after your baby is born. After the tests are complete, however, do you receive the results? Well, each test is a little bit different. You may receive the hearing test results prior to leaving the hospital. On the other hand, your healthcare provider will give you the results of the pulse oximetry screening. Similarly, when completed, results of the blood spot screening will be sent to both the birth hospital and your baby's healthcare provider, usually within 2 weeks. Moreover, what if further testing is necessary? Again, each test is a little bit different. For the hearing test, hospital staff will assist in scheduling subsequent evaluations. If the pulse oximetry screening results are negative, your baby has normal levels of oxygen. If the results are positive, their oxygen levels are abnormal. This does not guarantee your child has a heart disease, but your healthcare provider will continue to monitor your child and perform further testing if necessary. Finally, for most babies, blood spot screening tests are normal and you will receive the results at the next following routine check-in. However, if they are abnormal, your healthcare provider will arrange additional testing immediately and your child may be referred to a specialist or specialized organizations such as the ASCAA. Where does the American Sickle Cell Anemia Association come in? If your child has abnormal results for their blood spot screening, they may be referred to us, and we will perform a subsequent diagnostic test. This test is similar to your child's preliminary screening, but will be used to analyze their hemoglobin levels to determine if they have sickle cell disease. What is sickle cell disease? It is an inherited blood disorder altering the red blood cells sculpting a C shape, or also known or compared to a sickle. This causes afflicted cells to be more readily susceptible to destruction, and they often tend to die early. This leads to a variety of symptoms, including severe pain, anemia, which is a lack of healthy red blood cells, and a variety of other symptoms. How did my child get sickle cell disease? Sickle cell disease is genetic and requires a mutation in both beta-globin and hemoglobin genes. Children with only one mutated gene have what is called sickle cell trait. and symptoms typically don't arise unless exposed to extreme conditions. For parents who both have one mutated hemoglobin gene, there is a 1 in 4 chance for each pregnancy to have sickle cell disease. What happens if my child has sickle cell disease? As of now, the only cure is bone marrow and experimental stem cell transplants. However, there are a variety of treatments that can prolong and improve the quality of your child's life. These include staying hydrated, pain medication, blood transfusions to treat anemia, and specific sickle cell disease medication. Consistent visits with your child's healthcare provider and specialist will help to monitor your child's well-being and health. Again, congratulations on your newborn. We hope that your baby is healthy and continues to develop into a strong and safe child. However, if you need to contact us, we're always open to talk. We are the American Sickle Cell Anemia Association. You have the questions, we have the answers.